Welcome to the Australian Society of Plastic Surgeons Q&A, recorded especially for Breast Reconstruction Awareness Day or BRA Day on the 16th of October. Joining us is Specialist Plastic Surgeon Yvonne Chow and Clinical Nurse Consultant Melissa Woods. Welcome to you both.
Thank you. Yvonne, isn't it great that we're here and we're able to talk about BRA Day today, Breast Reconstruction Awareness Day?
Yes, I absolutely agree, Mel. I'm so happy to be here with you.
Yeah. So for people who aren't aware of what BRA Day actually is, it's the third Wednesday in the month of October, and it's all about promoting education and awareness and access for people considering post-mastectomy breast reconstruction. And it's really important that women who are faced with having a mastectomy know all the possible reconstructive options so they can make an informed choice.
Correct.
Yeah.
I think Mel, I think it's important that women have the option to have an immediate reconstruction or a delayed reconstruction, or to know that they can have no breast mound reconstruction at all, and they have those options available to them.
Yeah, exactly. And as a breast reconstruction nurse, I'm very mindful of how overwhelming it can be for these women to understand and sift through all this information. And then they have to make a decision at a time when they're extremely fragile. And it can be really scary and lonely for them, despite them having villages around them for support.
Mel, what you've described is so accurate, and I think that is where your role comes in as a breast reconstruction care nurse. So can you tell the audience, I guess, a little bit about how you support our patients?
Yeah, sure. Well, as their breast reconstruction nurse, I try to be that one consistent person in their reconstructive journey. I'm a point of contact for them from the first time we meet them at the clinic together. I have many conversations with them, ensuring they understand what the surgery actually entails, going over what you've told them, and what their post-op recovery will look like as well. And I try to provide them day of surgery support if I can, particularly obviously the women themselves, but sometimes their families as well. I visit them on the wards. Once they're discharged home, they can contact me if they need to. It's really important that they know that I'm there for them if they've got any concerns or worries. And of course, we see them at their follow-up clinic visits. And we continue to see them ongoing until their reconstructive pathway is complete and we no longer need to see them anymore. And probably really most importantly, although there's lots of most importantly's, I think, is being able to advocate for them if they cannot do so for themselves. That's a big one.
Correct. And Mel, I think your role as the breast reconstruction care nurse has been so important to our patients at Monash Health. The information, the surgery, and the recovery can be really complex. And you actually help and support our patients to navigate through this journey, to help them with their scary decisions that these women have to make.
Thanks, Yvonne. Enough about me. Let's move on to you. And I know that you're a FRAX qualified reconstructive plastic surgeon. For our listeners, can you explain what that means?
Well, I do have a FRACS in plastics or plastic and reconstructive surgery. And FRACS stands for Fellow of the Royal Australasian College of Surgeons. It's a mouthful. And the Royal Australasian College of Surgeons is the peak body that trains surgeons and maintains surgical standards in Australia and New Zealand. And you know, plastic surgeons have done many years of specialist training to qualify, and we are all well trained to reconstruct complex defects and deformities in order to restore form and function. And breast reconstruction is certainly a major focus during our training. And at Monash Health, where we both work, myself and several of the specialist plastic surgeons there, we spend the majority of our time working to help patients who need reconstructions after mastectomy.
Yeah, correct. And like, we know what breast reconstruction means, but can you explain to our listeners really what that is?
Yeah. So breast reconstruction is about helping women to recreate the shape of the breast following a mastectomy, or occasionally even after breast conserving surgery or even a partial mastectomy. And as we alluded to earlier or said earlier, it can be actually done at the same time of your breast cancer surgery, which is an immediate reconstruction, or it can be done at a separate procedure at a later time, even if it's many years down the track, and that's called a delayed reconstruction. And it's important to know that breast reconstruction may actually involve several operations to achieve that final result.
Yeah. And maybe because we're talking about mastectomy in that conversation, we should probably touch on it in a more broader terms, because there's 3 types, isn't there, of mastectomy? We've got our simple total mastectomy, where the surgeon removes all of the breast tissue, majority of the skin. And then we've got skin sparing mastectomy, where the surgeon will remove all the breast tissue but leaves as much healthy breast skin as possible so that you can fill the pocket with either an implant or their own tissue. And then there's also nipple sparing mastectomy. And so that's where the surgeon again will remove the breast tissue but leave the nipple, areola and overlying skin to once again fill that pocket with either an implant or their own tissue.
Well, that's very well explained, Mel. That is correct.
Thank you.
And all of these procedures, they lead to different scars and overall aesthetics of the breast.
Yeah.
And I guess that's why it's important to understand the differences between a total mastectomy or a flat closure, as opposed to a reconstructed breast when women are actually making their decisions about reconstruction.
Yeah, so true. And flat closure, what does that term mean?
Well, it's interesting you bring that up because, it's becoming more and more discussed on forums, etc., that I've seen. And I think many patients think of reconstructive surgery as building just the breast mound. But aesthetic flat closure is also, in a way, its own form of reconstruction. It can be done at the time of the mastectomy, i.e. immediately, or it can be done a few months down the track or after the mastectomy has been done, and that's a delayed flat closure. And what that involves is removing any sort of excess skin or pockets of fat or excess tissue and tightening and smoothing out the remaining skin to really create a nice flat chest wall contour.
Yeah. And when we have these discussions with our patients, we acknowledge that this is a valid choice, don't we? That's an option that they can choose.
Absolutely. And in some circumstances, flat closure will actually be recommended to the patient if they have a particular type of cancer. But, you and I both know that the majority of breast cancer cases or patients that come to see us, it's actually possible to offer a type of breast reconstruction. And it's something that women should be informed about prior to the mastectomy.
Yeah, correct. So what about there's another group, the ladies that know that they have the BRCA gene. They too will probably need to think about a mastectomy at some stage in their life.
Yeah, exactly. Younger women, thinking about this in their 20s and 30s, should really have the options explained to them so that they have the time to make an informed decision as well. And I feel that it's important, it's an important conversation that they should start
Yeah.
early so they know.
Yeah, agree.
Yeah.
So maybe we can talk about some of the reconstructive options that are out there. And one of those is implant-based reconstruction. Can you elaborate on this type for us?
Absolutely. Implant reconstruction, it's a common type of reconstruction in Australia. And it's
Mm,
when the breast mound is created using a breast implant, typically a silicone implant. And when the blood supply to the mastectomy skin is good, then it can be done immediately at the time of the skin sparing or nipple sparing mastectomy.
mm,
And, sometimes it can be done all in one stage.
yeah.
And at other times, it needs to be done in two stages, meaning a tissue expander needs to be inserted at the first stage. And this is an old example of a tissue expander, but
Yeah.
it's like a silicone balloon, which we fill up with saline when the patient comes back to see us at the surgeon's office after the operation. And we fill that tissue expander up to the desired size. And
Mm,
then at a second operation, which is scheduled several months later, we remove the tissue expander and then replace it with an implant.
mm,
And, generally speaking, the implant type reconstructions, the duration is usually shorter and the recovery is relatively quicker when you use
mm,
implants.
yeah. And because it's that quicker procedure and recovery, some will choose that option, obviously, but you might also recommend that for them. Why would that be the case?
Oh, Mel, I think that we really need to stress here that every patient's journey is different. Every patient is different.
Mm,
And there's really a lot to consider when deciding with a patient what reconstruction may be best for them. There might
yeah,
be factors like radiation, chemotherapy,
yeah,
lifestyle and physique, or even whether the patient's finished having their children,
mm,
the timing of the operation, and even sometimes social circumstances and
mm,
considerations are really important for women, like
yeah,
returning to work early and whether they have family commitments that they may or may not be able to extract themselves from. So
yeah.
all of these factors really need to be considered when helping women make that decision.
Yeah,
Yeah.
yeah, totally agree. And at Monash Health, where we work, we do a lot of own tissue autologous reconstructions, more so than some other types. But can you talk us through what an autologous reconstruction is?
Well, essentially, an autologous reconstruction is when we reconstruct that breast mound using a patient's own tissue.
Mm,
So we don't need an implant, it's not usually required. And most commonly in Australia, we tend to use the skin and the fat on the lower abdomen.
yeah.
There are also other parts of the body that you can use, such as the inner thighs and also the upper back. But the most common reconstruction that we do is the DIEP flap, the DIEP flap. And that stands for the deep inferior epigastric perforator flap. And we take the tissue between the belly button and the bikini line, and depending on how much tissue that patient has, there may be enough to make one or maybe two breasts.
Mm,
And the resultant scar is on the tummy and basically goes across the lower abdomen from hip to hip, as well as
mm,
a small scar around the belly button as well.
yeah.
Um, and this type of reconstruction, it involves a longer operation. It does
Yeah.
have a longer recovery. But in the end, you end up with a breast mound that feels soft and warm. It feels similar to the original breast tissue, and it
Mm,
actually tends to age with you over time as well.
yeah. And if you put on weight or lose weight, it
It tends to
that's
increase and decrease in
yeah,
size.
exactly. Yeah. So actually, who performs the DEP reconstruction, own tissue
Well,
reconstructions?
you know, typically it is a specialist plastic and reconstructive surgeon. And in fact, some plastic surgeons like myself and other colleagues who specialize in breast reconstruction will have actually traveled overseas to after they've completed their FRACS to consolidate their learnings so that they actually become highly skilled in this type of microsurgical reconstruction.
Yeah.
And when we talk about the DF flap, it's actually performed using microsurgery. So we're working on very, very small vessels underneath the microscope at about 40 times magnification. And when you pull a hair out of your head, that hair is actually thicker than the stitch that we use to stitch up those little vessels. So that's showing you how fine the surgery is.
And the expertise that's required.
Yeah, correct. And this, you know, I would have to say that this specialised operation is really offered mainly in the major city centres. And it does mean that some regional patients need to travel to access this type of operation.
Yeah, we've had quite a few ladies from regional areas and even further afield.
Yeah, we have.
And with amazing outcomes. So in talking about all those options and just kind of recapping, it sounds like, you know, the surgeon, it's shared decision making with the patient and the surgeon. There's a lot of factors to cover for the woman to actually be able to make that decision. And it's about their lifestyle, their family, what their job is, what their goals for the future may be. All of this information is quite critical, isn't it, to them, so that they are informed and make a choice that's right for them. So I suppose that really kind of brings us to why we're here talking about Bra Day, doesn't it? The more women that are made aware about the different types of reconstructive options, whether they be implant, flat closure or own tissue, hopefully the less confronting it may be for them if one day they are diagnosed with breast cancer and have to make a decision about having a mastectomy, to know that they actually have options regarding their breast.
Correct. And I guess I'd like to finish off by saying that breast reconstruction, it's a very personal choice. It's a woman's choice. And it's about making that right choice for yourself.
Yeah.
So, you know, I would say to women, do not hesitate to ask your breast general surgeon to refer you to a plastic surgeon to discuss your options, or even, you know, reach out to the Australian Society of Plastic Surgeons, because they will be able to direct you to a specialist plastic surgeon in your area.
Yeah. Fantastic. Happy Bra Day, Yvonne.
Happy Bra Day, everyone.
Yeah.
Oh, and thank you, Yvonne and Mel. That was such an informative session, and I'm sure it will benefit many women and those who are supporting them along their journey to breast reconstruction. So for more information and to find a specialist plastic surgeon, just visit our website at plasticsurgery.org.au. Thank you.